Welcome. Thank you everyone for bearing with us. I am extremely pleased to have Dr. Tamsin Lewis here with us this evening. Dr. Lewis has been recovering from an acute case of COVID-19 and joins us here to discuss her experience and lessons learned, both as a medical professional and a victim of the virus. Dr. Lewis is a King's College trained with a postgrad qualification in psychiatry and a BSc in neuroscience and biology of aging. She's also a Lanserhof at the Arts Club practitioner and former GB elite triathlete and Ironman champion. If anyone has any questions over the course of the talk, please do just type them into the box at the bottom of your screen, and Dr. Lewis will field as many of them as she can at the end. So hello, Dr. Lewis. It sounds like you've had a very rough few weeks. How are you feeling?
As I know we've discussed, Susanna, welcome. Hello, everyone. It's been a very bumpy course, and certainly one that I wouldn't expect with this coronavirus, the COVID-19. It's kind of, sometimes it can be two steps forward and then one step back. You can have a good day and then, you know, you do a bit more and then you're set back a bit, even further. So would you like me to just talk a bit about how it started and then the sort of time course? How would you like me to, go back?
Could you tell us like how and when you think you might have contracted the virus?
It's very difficult to say, I think, for a lot of people, given that in London it seems to be very endemic now. But I first developed symptoms back around the 15th of March. I, in retrospect, was probably exposed to a number of people that have since had symptoms of the virus. So there might have been multiple exposures. My first symptoms were quite common. They were feeling shivery, had an abdominal pain in the right side of my stomach. I developed a fever overnight, which was recorded on the Aura Ring, as you were going to talk about. It's a wearable device that tracks your body temperature, amongst other things. And that gave me a really bad score, and I felt something was up. So it was like a fever that I hadn't really had before. Woke up in the night to have a drink of water, and you just feel like everything was so heavy. And then literally the first week was pretty much a fever. I then was given Tamiflu, which at the time was recommended that it might have some benefit. We now know it doesn't have really much of a benefit. It definitely helped my temperature, so my fever went down after 2 days, but then I started to develop very slowly this shortness of breath and this tight chest. Didn't really have much of a cough. And then on day 7, I developed this extraordinarily painful sort of inflammatory pain in my hips and my lower back. And I remember lying in bed thinking, this is amongst one of the worst pains I've ever experienced. I called NHS 111 because I felt very alone. I was actually with my 5-year-old on my own in the house, and I felt quite distressed by this pain because I felt very inflamed, plus the shortness of breath. Anyway, we now know that is a sign of more severe form of COVID-19, and a lot of people will not experience that, but that severe deep muscle pain is a sign that you need to contact your health provider or NHS 111 in the case of the UK, who are fielding everything at the moment as regards to COVID. So I was given a prescription of codeine phosphate because paracetamol wasn't touching it at all. I was also given a prescription of azithromycin, a type of antibiotic, because at that time my chest was getting a little bit worse. So that happened, and then I started to feel a little bit better about day 14. So the next week was basically spent feeling, pretty ghastly. And at day 14, I started to be able to walk a bit more, felt a bit brighter, and then went on a walk that was, so day by day I was doing a little bit more. And then day 14, I did this walk, which was, it basically set me back. almost back to sort of day 2 or 3 again. I ended up having widespread joint aches, pains, shortness of breath. My breathing got worse, and I was literally in bed and could not move. It was pretty terrifying at that time. And at that point, I was given another course of azithromycin. I also trialed the quinone. I know we're going to talk about that a bit later, the malarial drug. It really didn't suit me at all, and we'll come back to that. So from that time, so my setback again, and gradually I got a little bit better, and I did a few Instagram videos. I shared my story just to kind of get out to people, this isn't as simple as it certainly doesn't feel like the flu. And in some people, it can have a very bumpy and even a severe course. I was able to manage at home with the advice of a couple of private doctors, and also again, the NHS 111, because if you are to be admitted to hospital, everything has to go via them. I had a few home monitoring devices, including the Oura Ring, which again, we said we'll talk about. I also have this, it's called a pulse ox monitor, and you put it on your finger like that, very cheap device you can buy on Amazon, and you basically turn it on and it measures your pulse rate and your pulse oxygen. And keeping an eye on that is one of the key determinants of whether you need to seek more advice and to really ring the hospital or to ring NHS 111 and to go into hospital. That you'd take advice from your own medical professionals about what that number is, because it does vary depending on other coexisting health conditions. So that has been very helpful. Again, got a little bit better, and then I had sort of around I think it was about day 25. Again, every time I pushed to do something, more walking, more moving around, cooking, playing with my daughter, work, anything exhausting, when you feel okay during the time, it was definitely a setback. And then day 25, I developed a very strange reaction, like an anaphylactic type reaction, where my face swelled up, my neck swelled up, my pulse went sky high, and that is what actually took me to hospital in the end, which appeared to be, it's obviously related to the COVID, but it's secondary. It's, my breathing was affected by this kind of immune system activation. So I actually went to hospital at that point, and I was given an antihistamine and some oxygen just to help my breathing, because at the time my chest got quite constrained. And then just after that, basically since, I've felt very tired, but a little bit racy. So my nervous system, my sympathetic nervous system, what we call the fight and flight, which is the thing that gets you mobilized and going. And often in an infection and after an infection, that can be heightened, so that it's almost like your system is primed to field any threats that come in. It's hypersensitive. So that's basically where I find myself now, trying to sleep more than usual, doing very little activity, and really taking care of my diet, some strategic supplements, trying to spend some time, in the sunlight.
I mean, it sounds like you've had so many symptoms, because, I mean, normally we're just hearing of people having a few, and you've had, I mean, multiple. Have you seen that in any of your other patients as well?
So I think I got, as we know, much more people are getting the illness now. And I, as the pandemic has gone, I got it quite early on, and the symptoms, as I've said, have fluctuated significantly. But a lot of people I know are having more vague time courses, more of their symptoms. A lot of people aren't being diagnosed, as we know. They're not able to get a test. I did get a test privately, a swab test, and then subsequently this week an antibody test. But there are a variety of symptoms, and a lot of people are reaching out to me saying, could this be it? Could that be it? I've got stomach pain. I've got a low-grade fever. I don't have a cough. I'm not short of breath. Could it be it? So there's this kind of web of not knowing at the moment because of the unavailability of the tests. And hopefully that will change soon. As you know, there's a number of initiatives going on to try and get more tests to more people. Obviously, we have to prioritize healthcare workers on the front line at the moment.
So going back to hydroxychloroquine, so that's a synthetic compound, isn't it, that was created 75 years ago to replace quinine. It's a malaria treatment, and it's been used against chronic inflammatory diseases like lupus and rheumatoid arthritis. And that's not something that the NHS is prescribing, is it?
It's not something the NHS are routinely prescribing. I think a lot of the time there's a lot of different, it's an off-license, off-label use of this drug. So, in hospitals all the time, different drugs are being trialed for this and to treat the more severe form of COVID. So there are trials going on in different hospitals trialing hydroxychloroquine, for example, even in the UK, but it's certainly it's not being used widely, despite Trump's favorable response to it. But there was a study that came out of a French hospital of tropical medicine immunologists that was hailed as being saving 32 people, hydroxychloroquine and azithromycin together. So a lot of people picked up on that and said, look, this has to work, we have to try it. And I think there's been this case of this fever over, like, this is a virus that we don't know how to treat, we don't know how it's acting. So anything that is not potentially harmful, we're going to try, because we haven't got anything else right now. But, as a medic, you say first do no harm. And these drugs are not to be used without medical supervision. They should be, discussed with your doctor, because, for example, it can lower your blood sugar level. It can cause, muscle spasms, muscle weakness problems. Yeah. And there's famous stories in the press that people highlight of chloroquine, which is the precursor, as you said, the dirtier version of hydroxyquinone, which, people were drinking fish tank cleaner after Trump's newsflash saying, thinking that would cure it. So we have to be very careful about, indiscriminate use of these drugs. And in the same vein, there were a lot of people going around accumulating HIV medicines, this post-exposure prophylaxis HIV medicines, which were shown, which are being used in hospital, are being used in trials in more severe forms of this illness. So there's this hysteria, the same as we saw around toilet paper, people just getting whatever they can, because we really don't know how to treat this illness. But as I said, if we buy time, that's the most precious thing, because we're learning all the time. Trials are going through FDA, they're going through clearance a lot quicker than they used to. So with that comes this, this kind of safety concern about some of these drugs that are being used. But, so don't try anything without medical supervision. So yeah, I hope that helps.
As an elite athlete, were you surprised that you got it? Are you seeing the cases being discriminated against from? Obviously we know that the older you are, the more vulnerable you are. But were you surprised, given that you're in optimum health?
Probably preempt that by saying I'm not in optimum health. I'm pretty fit, or was pretty fit. And yes, I was surprised, but we have some theories around the more exposure you have to this, the viral load that you experience at first infection can determine how bad the illness you suffer from eventually. I also had, I had some kind of chest infection in January. I returned from a period in Thailand. I was working in Oman over the Christmas period, and I had some chest symptoms in mid-January. I have no idea, if that could have been COVID related or not. But so I had a predisposition there, and my chest was recovering from that. And then this kind of came in and hit. I also think that it needs to be highlighted that in terms of exercise and fitness, endurance exercise is immunosuppressive, so it can suppress your immune response and also cause oxidative stress in the body, which can impair how well you deal with pathogens like this virus. So whilst I have a lot of cardiovascular fitness, I potentially have, had a deleterious effect on my immune system during my time as an athlete. So I think that's a word of caution to a lot of people that are trying more extreme forms of exercise. I know people are being, not able to do that right now, but more exercise is not necessarily better for our health.
Okay.
But I should suggest on that point as well, I've beaten myself up saying, why have I got such a severe form of this? I'm meant to be a wellness doctor. I work in preventative health. I've kind of been round in circles around that. And, it's hard to have an answer. But I have spoken to people who are young, fit, and have been suffering from vague symptoms related to COVID for up to 6 weeks. So I don't think that being young and fit can necessarily, exclude you from developing a more severe form of this illness.
And would you say that eating a healthy diet and taking supplements can ward off the virus or reduce its effects?
For sure, it plays a part. I don't agree with this hysteria that's now online about, vitamin C is going to cure this, zinc's going to cure this. None of these things are curative. They can have benefits on the immune system. Listen, I think the number one thing that we need to highlight is that, number one, there's many things, but it's an important point. Stress and the hormones of stress, like cortisol, adrenaline, noradrenaline, are all factors that cause an immunosuppression. That is, it affects the ability of your immune system to mount a good response to prevent this virus from replicating. So stress comes in many forms. Exercise is a form of stress in excess, sleep deprivation, excess alcohol, smoking, other toxins, dysfunctional relationships, dysfunctional breathing patterns. So I think that we shouldn't underestimate the role that stress can play on the immune system. So whilst diet is very important, we know that refined sugar and excess carbohydrate intake can cause inflammation in the body, and then the virus and the side effects of the immune system with the virus cause inflammation in the body, which worsens side effects. So for sure, having a diet that's cleaner, lowering in refined sugars, that potentially periods of fasting can be beneficial for the immune system because they encourage a process called autophagy, which is cellular clean out essentially. So I often advise when I work with clients that they do intermittent fasting. We do know from some of the evidence that's coming out now that things like vitamin C, as you know, I know I said that there's been a little bit of hysteria, but higher doses of vitamin C have definitely been shown to help with the oxidative stress, the inflammation that's created as a result of this illness. I use this liposomal form of vitamin C, Altriant, because it's highly absorbable. If you buy ascorbic acid from Boots or wherever, it at the doses needed, up to 10 grams a day, that can really upset the stomach. So that and there's various other things that can help, and there's tons of information online about anti-inflammatory.
Is vitamin D3 advised, or colostrum, or magnesium, zinc?
For sure, all of these things play a role.
Oh, hi, Tamsin, we're losing you. Just waiting for Tamsin's connection to come back. Hopefully it will. Thank you for bearing with us. Just trying to get Tamsin back with us. Tamsin, I think you're
How's that?
back now. Yes, sorry, we lost you for a moment.
I'm so sorry, I don't know what happened there. Okay.
No problem. Yeah, you were talking about zinc, D3, colostrum, magnesium.
Sure. Let's stick on vitamin D because that's a very important one. We know that there's links to vitamin D and the immune system. Now, it's very helpful to know your vitamin D level because indiscriminate use of vitamin D can have, can cause problems too. So if you are known to be low on vitamin D, then for sure, mega dosing of vitamin D up to 10,000 units can really help. So it's worth, there's very cheap and available tests now to measure your vitamin D level online through a finger prick, so you don't have to go in. So for sure, vitamin D is important, especially at this time of year. Also, if you can, getting in the sunlight, you've got to take into account some skin cancer risk, but also getting some UV on the skin is a very potent way to raise your vitamin D levels. So vitamin D is very important. But as I said, some people can actually get very high vitamin D levels who've been supplementing for some time. So it's good to have some objective baseline. Colostrum is recommended because it can help improve what we call secretory IgA, which is an immunoglobulin secreted in our saliva and also present in our gut. So it's one of our first lines of defense. So colostrum powder is usually the best. Companies like Neovite, or you can take that before you go to bed. Which other ones did you mention? Zinc?
Zinc and magnesium.
So zinc is interesting. We know that in the form of a lozenge or a liquid where it's kept in contact with the throat, especially if you've got swollen glands in the back of your throat, that can be very helpful, but frequency really matters. You can't just have one. If you have first sign of symptoms, a sore throat, a little bit of a cough, then you should really have a zinc lozenge 1 an hour, or gargle with something. I made a few props. I was using this liquid zinc BioCare and just gargling with it and trying to keep it in contact. So we know that it matters, that dose matters, and also contact with the glands at the back of your throat matter. Magnesium is really helpful because it can help calm the nervous system. One of the things that I've really found with this illness is you need rest in order to recover, but it's very difficult to rest because the anxiety component is huge. Not being able to breathe, then having pain, and magnesium specifically transdermal, that means through the skin, so you can have a hot salt bath. I've been advising people do that with Epsom salts or magnesium salts you can buy cheaply, big bag, 1 kilogram in the bath. Magnesium glycinate, if you're taking it as a supplement, is the form that calms the nervous system, and magnesium threonate, those are the two. Magnesium oxide, the cheaper form, is potentially helpful for muscle spasms or muscle weakness, but it can upset the gut, a bit like ascorbic acid. So also things like melatonin, which is a prescription-only drug in the UK, have been shown to be an antioxidant as well as helping sleep. So anything you can do that really could, if you do get infected with this illness, then anything you can do to really calm your nervous system and help sleep is
Sorry, what could help our respiratory systems?
Okay, so what really helped my respiratory system, and I'm hearing it can help. Obviously, vitamin C can help prevent some of that oxidative stress, that inflammation in the lung. But again, it has to be frequency and dose matter. So hourly dosing of vitamin C on first sign of symptoms, 1 gram. So that could be 1 sachet of things like those Outgens. And also a nebulizer. I haven't got one here. They're like cheap little things you can buy on Amazon, and you can put saline into the top of it, and you have it like a mask, and it blows over, and you just breathe it in, and that can help open the lungs. If you have asthma or any other conditions, you obviously need to contact your healthcare provider, but nebulizing your inhaler can really help just with the mask and breathing it in. Steam showers can really help. Because with some albus oil, because the steam in the shower can really help open up the lungs. That really helped me. There's a supplement called N-L-acetylcysteine, a form of which acetylcysteine is used in intensive care units to help lung function. So N-L-acetylcysteine is one other supplement can help. Some evidence that oregano oil can help. time tea, those kinds of things. So those are some of the things I found helpful.
Thank you, that's really helpful. And what kind of foods should we eat if we are recovering from the virus?
So I think it's important to note that, you know, if you put weight on your digestion, that's going to take away potentially some of the, you know, digestion requires energy. So I think things that are relatively light on the gut are helpful. Sorry, I'm going to take a deep breath. We know that bone broth potentially is helpful, and that can be just made. You don't have to buy the expensive Dalesford and all the rest of it. You can just boil up some bones if you have it. I know that doesn't sound palatable to a lot of people. Bone broth is high in glycine, which is an amino acid that can calm the nervous system. It's also high in glutamine, which is good for the immune system. It's also high in collagen, which a lot of the collagen peptides, which can help in the inflammatory process in the body. I've been using a lot of MCT oils, medium chain triglycerides, which are found in coconut cream, and also like coconut oil. I've been putting a spoonful of that in my decaf coffee because I've been avoiding stimulants because that can impair your recovery. Also foods high in polyphenols like blueberries, dense blueberries, frozen are best, the red currants, those kind of things you can buy from Waitrose or any supermarket really. Those are very good. The more colourful your diet, the better, because there's lots of antioxidants in food, and antioxidants help that inflammatory process, and that inflammatory process is what causes the side effects with this illness, the malaise, the muscle aches and pains, and the sleep disturbance, which can come from this agitation in the nervous system. So those are some of the things. Avoiding alcohol, or minimizing alcohol, even though a small amount of alcohol can help calm the nervous system. Again, avoiding stimulants like coffee, or at least switching to decaf or reducing the amount of stimulants you have, because that can impair your immune system response. I think that's about it.
That's a very good list. What were you finding was helping you sleep?
I mentioned melatonin, and usually I don't tolerate melatonin too well. It can affect our mood. It can make you feel a bit like a bit dysphoric. But if your baseline's different, if your baseline is more agitated, then it can just bring you down. So I've been using something called this sleep remedy, which is created by a US physician called Doc Parsley, and it was created for the military. He was working for the military to try and get people off sleeping tablets, because there's a big problem with addiction in the military with sleeping tablets. It contains a small amount of magnesium, melatonin, only about 0.5 of a milligram, magnesium glycinate, tryptophan, 5-hydroxytryptophan, both precursors to serotonin and melatonin. So it's a synergistic blend, and you drink it like a tea. And I use it with a lot of my clients too, because they always come back for more. I really recommend that. But if you can't get hold of that, then you can contact me if you want to try it. But you can use simple 1 to 5 milligrams of melatonin, whatever source. But as I said, it's prescription only in the UK. A lot of people travel a lot where it's not prescription, so they might have stock from the US, for example. So melatonin is recommended. Magnesium glycinate, as I've said. L-theanine is very helpful. It's an amino acid that calms you. But again, dose matters. So don't just take one. You might need 3 or 4 if they're 150 milligrams, for example, of L-theanine. Chamomile, all of those things, and we should talk about more lifestyle measures to
mindfulness or breath work.
Yes, exactly. But I think the number one thing is circadian rhythm disruption. So, it's difficult with our lockdown to get natural light in the morning, and then really to shut down artificial light in the evening. But that's really important in regulating our own production, our endogenous production of melatonin, which is what we need for deep sleep. So I encourage people to try and get bright light in the morning. If they can't get outside, then get a Lumi light or something similar. The anti-SAD lights really can help. And then switching off or adding, night mode to your computer or your devices at night. And what were you saying? Something else? Sorry. Oh, mindfulness and meditation. Yes, yeah. I've become a meditation geek over the last month. I never really made time for it before. I did a bit of work with Dr. Joe Dispenza, who has all of his own meditations, and he sent me a personal meditation to help my immune system, and it was profound, actually. I think at the point he's now might have released it, so we can link to it for people, and it's really to encourage you to have a deep meditative state, and then to encourage your own immune system to become more synchronous. And so I think that's helpful. I think the Calm app have some very good recordings on it. As you know, I do some work and with the breath guy who does transformational breath work. A lot of that is similar to Wim Hof type breathing. It can be hyperventilation followed by periods of like breath holding. Very difficult to do if you've actually got chest symptoms, if you do get an infection, but actually as a prophylactic and a method to help calm your nervous system generally. Breathwork has been game-changing for me to give you, it sort of hijacks you into a meditative state, because a lot of people say that I can't meditate because my mind's too active. And what breathwork does is kind of take that away. So by focusing on the breath, that thinking mind, that monkey mind, the prefrontal cortex actually goes offline, usually with the change in the gases in the blood as you do the difference in breathwork. So that can be helpful. He's the breath guy.
Once a day, or how long do you recommend?
So it depends what you do. I recommend, Richie's just launched his own app, and there's a lot of free links on there, the breath guy. And he does different, so the transformational stuff is really like a 30-minute session where you need to just really take time out. But, you know, deep breathing, so we call it box breathing, in for 4, hold for 4, out for 7. So really accentuating the out breath is really good at triggering the parasympathetic nervous system, which is the rest, digest, calm. So it's like, you know, in for 4, like big breath, hold, and then really long out breath. And you can do that for like 3 or 5 minutes. You know, we've all got wearable devices at the moment that, the Polar has a serene breathing app, the Garmin has one, the Apple Watch has one. So we all know that the really being able to center and calm our breathing has an important role in centering and calming us. I use also I'm a device gadget queen. I use something called the Apollo wristband, which you wear on your wrist, and it sends an impulse into your nervous system, which triggers vagus nerve, so the parasympathetic nerve. That's Apollo Neuroscience. Really interesting device that can really help to calm mind and lot too. And I can see the effects through my Oura Ring on how that affects my heart rate, and can lower my heart rate and increase heart rate variability, which is a measure of stress in the system.
Do you keep that ring on all the time?
I've worn this ring for 3 years now. So I'm just going to get a drink. I'm an early adopter of this ring. I met the founder of Oura back in 2015, I think, with a chap called Ben Greenfield, who's a sort of a biohacker, US #1 health and fitness type of person. So I've worn it for a long time, and I keep it on. I use it with my clients. I find it very helpful because we get a dashboard called Oura Teens, so I can see all of my clients' data. I can see how they sleep, their stress patterns. I can see when they've been out on the lash, boozing, because your heart rate takes longer to drop overnight. I can see when there's been activity in the night. It's a little bit Big Brother, but it's all confidential. Very interesting device. And usually, apart from losing it down the toilet in some cases, or down the plug hole, people keep it on, and it becomes like your, you know, like your pocket, you know, like assistant, really. It's sort of like a feedback metric on how did I sleep, how am I recovering. And during this illness, it's been fascinating. They're actually doing a study, or have joined with UCSF, University of California, to see if there's any predictive metrics that can be used to predict who's getting a more severe form of the illness. And certainly if I plot trends of the data, I can see the elevated heart rate, the elevated body temperature, and this reduced what we call readiness score, which is what the Oura Ring gives you. And the higher your readiness, the more fit and healthy you are to tackle the day. The lower your readiness, that means that your system has stress in it. So it's a nice gadget. I do recommend it, and I know that the Arts Club, the Lanserhof, are working in collaboration with Oura too.
How much do they cost?
How much do they?
How much do the Oura Rings cost?
About £300, I think.
Imagine,
unless you want to try one.
Yeah, and people are now updating apps with their data during this virus too. So I imagine more and more people will be wearing these types of devices going forwards. Can you tell us a bit about shedding? So we can shed the virus before showing symptoms, can't we?
Yeah.
Yeah. Can you tell us a bit more about which points we can shed the virus?
In terms of okay, I mean, the data is still coming out about this. I think one of the ways that this virus is transmitted is through droplet transmission, which is coughing, sneezing, touching your face, leaving hands, and then that kind of thing. So I think people have to be very careful. We all know how often we should wash our hands. We know about touching our face, those kind of things. It's very unclear as to how long this virus lives on furniture, boxes. I know there's big concern around deliveries, etc. I think that fear has been overestimated from some of the research that I'm seeing. I think the more you cough, sneeze, and have other symptoms, I think the more likely you are to be shedding. We now know from new data that you're actually contagious before you show symptoms, which is potentially worrying. So you can be 2 to 3 days before you actually start having symptoms. You can be contagious.
And people who are asymptomatic, how do they shed, and how will we be able to test them, and can they remain shedders and have sort of recurrent episodes like the herpes virus?
That's the kind of thing that we don't know. For my own case, when I was saying, is this the virus reactivating, or are the symptoms simply an effect of an immune system that's gone haywire after the first initial infection? We do not know that yet. I'm anecdotally using my N+1 case here, where I had a swab at day 16, which was positive, a nasal swab in the back of my throat for viral RNA. I then did an antibody test 2 weeks later, which showed I did not have, 10 days later, sorry, which showed I did not have active infection and had developed immunity, had the IgG antibody. So I think it's going to be a case-by-case basis on who's contagious, who's infectious, and how long that lasts. And we won't know until we get reliable test data. I know that the government's looking at initiatives with Google, Apple, and Amazon to do widespread, increasing testing of people, and giving you a sort of green light through an app to say you can go out. So we're limiting exposure, really. I think that's the first thing, because you don't know who's got it and where it is, for example. So you just have to be careful. So I'm afraid not to provide a more conclusive answer to that, but we're learning all the time.
Yeah.
But this is exactly what's going to happen. You're going to have an app that gives you a green, like a traffic light a traffic light, whether you're good to go.
Yes, we're looking forward to having that. I mean, the question I can't seem to get my head around is that at the moment they're testing for antigens, i.e. like the presence of the virus in your body at a specific moment in time. So they're testing frontline NHS workers. So if they're negative, they then spend all day working with the coronavirus patients, and then they could test positive tomorrow. So unless they are being tested every day, surely those tests are pointless.
I mean, yes, you have a point. At what we don't know how, we really don't know what level of viral material in the nose and the throat, if we are swabbing, is necessary to cause a positive result. You know, through my own case, my housemate that lives with me doesn't share the same bed, but, you know, shares everything else. We assumed that he had it because he had mild symptoms. He tested negative on the swab. He tested negative on the antibody test. Also, my au pair, she had symptoms, didn't have chest symptoms, but had everything else, you know, malaise, headache, all of that. We don't know how much was psychosomatic. She tested negative. So, you know, and I didn't have, you know, classic high viral shedding, like cough or very little cough and not many mucus secretions. So we don't know, you know, and I think you just err on the side of caution. And when this started, it was very much like, well, let's just all get it, you know, if we're relatively fit and healthy, let's all get it and get herd immunity. But now we know that actually some people who are fit and healthy, as we've said, are getting severely affected. So until we know, until we can predict with some degree of certainty, you know, how likely you are to be severely affected, then you are on the side of caution.
And with the antibody tests, they won't effectively prove whether we've built up immunity, sadly. Is that right?
Well, again, theoretically, having IgG immunity is a sign that you have some kind of immune protection against the current form of SARS coronavirus, CoV-2. Whether there are, you know, whether there are different strains that require different antibody response, you know, that hasn't been made clear yet. There's articles published relative in the last few days showing that the blood of people with these immunoglobulins, these IgG, it may be prevent, you know, may help people with the disease. So until we can really get good clinical data, which usually takes time, which is why I said the most important thing here is to buy time if you can, which is what the government's doing with these social isolation policies, as draconian as they are, is buying time. So yeah, I think that's, you know, again, case and learning. We just don't know. We hope, I know Dr. Tim mentioned about this, talked about it, you know, that the virus could mutate and therefore our immune system doesn't recognize it and therefore it needs to produce new antibodies. We just don't know. It's a bizarre type of problem, and I'm hearing cases as well. I forgot to mention this because I had it as well, and I've spoken to a number of patients that have had it because of the immunosuppression compromise that this virus causes. You can get other mild infections or other types of infections that you wouldn't otherwise get. So sinus infection. Kidney infection, some people are getting more severe forms of urine infection. I've had other people get, you know, pneumococcal infections, influenzas. So it's just being, you know, mindful and having good contact with healthcare professionals if you do develop strange symptoms. And there's a lot of strange symptoms. You've all heard, you know, loss of smell, taste, nervous system. I had like tingling, weakness in all my legs. My knees swelled up. You know, having these arthritic symptoms, I feel, and, you know, it's bizarre. And, you know, as we said, unpredictable. And I'm in contact with people daily who are working in ITUs in St. Thomas's and Lewisham. And so I'm getting sort of feedback from the front line of, the different drugs that are being trialed and being used in the hospitals. And, you know, what we do know with some degree of certainty is that that people that have diabetes, that have high blood pressure, that are overweight, that have other pre-existing health conditions are more likely to, you know, have a higher mortality rate. You know that, it's in the media. But other more subtle things are proving more difficult to understand.
I mean, do you think if one has had the virus, you are less likely to catch it than someone who hasn't had it? Again, like to catch it.
Yes. Yeah.
Yes.
I mean, that's what the government is suggesting doing. You know, I have the antibodies, green light, get on with your life. I get that that's what we're going to be doing. We're going to be tracing people more widely using technology and apps to see who's been infected and whether they've recovered and therefore can go out again.
Yeah. And are you wiping down your groceries and cardboard boxes delivered to your door?
No, I'm not. Is the truth, because Well, I mean, I've just not been convinced enough about the cardboard box data. Plus, I guess I feel like I've had it, and I feel some conviction in myself that a reinfection is unlikely. But you know, I can't be 100% sure about that. You know, some people have bought UV lights and they're scanning their parcels with UV lights, which theoretically could help kill off any viruses. So, you know, err on the side of caution, you know, specifically if you've got health risks. You know, I know that my mother is, I've been distancing from her, but she's doing the UV light thing and wearing gloves and masks. So it seems sensible, but again, we just don't know. As I said, I think it's been overstated, the cardboard box data.
And on mental health, so I mean, we know to improve it, we can stay connected with friends, family, keep busy with hobbies, physical activity, trying to stay calm, mindfulness, reduce our information intake. I mean, is there anything else that you would advise for maintaining our mental health?
Not watching the news is the number one. It's very difficult not to, but you know, I just had to turn it off because I could feel the impact it was making on having on me and also my daughter. Listen, I think it's, and also the, you know, the hysteria on Instagram and all the fake news, I think that's very unhelpful. So if you can try and isolate yourself from some of that, I think that's potentially helpful. We've talked about trying to do some meditation. I think if you can get out in nature, I know we're restricted in what we can do, but I think it's important to try and get light and to be in nature once a day if you can. Trying to do more calming activities, trying to do yoga, trying to do breath work, trying to connect with your family. Perhaps use this time as a time of personal development, not join in the hustle and all the million Instagram lives, and you know, everyone's trying to build new businesses and new things, and there's a massive sense of hustle and hysteria online. And I think you know, it's helpful to kind of break through that bit and just try and sit with yourself and connect and do things that you haven't done for years, and maybe just try not to take on this, you know, the mass hysteria that's out there, because that really does have an impact on our mental health. And if we're turning to drugs and alcohol and other numbing substances, it's that obviously has its downsides as well in terms of impact on rebound impact on sleep and on relationships. Now this is a difficult time. I'm not being, you know, in no way ignorant of it. We're in confinement. We're not able to do the activities that would otherwise keep us mentally healthy, but some could use the example that these activities are helping to repress some of our, you know, deeper levels of psychological dynamics going on within ourselves. Things like, you know, over-exercising, extreme advice, or, you know, socializing, all of those things, those habits, those behaviors can, you know, have been used for many years, and now they've suddenly been stripped of all these things. So, you know, just I say reach out to friends or supportive people as much as possible. Having a community amongst this has been so helpful for me. Yes, Instagram's played a little bit of a part of that, but I've, you know, been cautioned with the use of it. But, you know, really trying to connect with and do all the things that you haven't been able to do for these years because we've been so busy.
Thank you. That's such sound advice. Just before we open up to questions, can you tell us a bit about longevity?
Sure. Longevity was kind of is a concept that I suddenly came to my mind because I've been very interested in the work of people like David Sinclair about longevity and this whole business of longevity and how do we create longevity. And then I started to think, well, do we really want to live longer? I mean, a lot of people get to that and you're like, I don't want to live longer, but we do want to live well longer. So I came up with this concept of longevity, which is essentially how do we create health span? And through my time as a doctor and a practitioner and you know, my own personal experience, I started to realize that the co-creation of healthspan through guidance, through expertise, practitioners, can really be helpful. And one of the reasons I became so obsessed with data is because it can objectify really that process. How do we determine how healthy people are? Because it's different for different people. I think having your one-off yearly medical can be really unhelpful, because through that time lots of things happen. What I like about more frequent testing, or using wearable data like the Oura Ring or other devices, Whoop wristbands, those kind of things, you get more daily trends of your own physiology or your biochemistry. So I really like to do in-depth checks on people. Longevity is essentially, it's a concept, but it exists in its an iteration now as a business with myself, a psychologist, a naturopath stroke nutritionist, and I do consultations with the Lanserhof now. So I had started doing consultations at the Lanserhof at the Arts Club before this kicked off. And then we have regular contact with people, and essentially you do a deep dive into your blood test data, your body composition, some strategic genetics, again using wearable data, and then we basically highlight your key concerns, and then we work on them, and we signpost you to whatever practitioner we think can really benefit you. But it's very much a co-creation, so the dialogue is very important.
That sounds excellent. And Lanserhof are still doing their infusions at the moment, aren't they, for boosting?
They are. Yeah, again, the vitamin C, zinc data is fairly promising. We'll watch that. It is being trialled in various big hospitals, so it's good that they're still doing their infusions.
And trauma therapy, amongst many other things. Tamsin, we've got.
That's helpful. I've talked about it quite a few times, but I think it's helpful because if you're having an infusion, doing a blood test to check your vitamin D, to check your B vitamin status, to check your inflammatory levels, you might as well. So, the Lanserhof can arrange that to be done at home, or you can, if you're going for an IV, they're using very good, exposure kit there. So, yeah, I would recommend that.
Thank you, Tamsin. It's been so interesting speaking with you. So if you'd like to just field some of the questions.
Sure. Where are we? Q&A. Okay. If you have used an antibody test, what is the significance? I think we answered the first question actually, which is basically asking what is the significance of the IgG and the IgM positive results. As I mentioned, so the cassette that is being widely used at the moment shows IgG and IgM antibodies. The IgM antibodies are meant to indicate active infection. The IgG antibodies are meant to indicate past infection and some degree of immunity. Again, we're not totally sure on whether having the IgG antibody confers immunity. So watch this space. Can you get reinfected? Again, we discussed that. Personally, I think it's unlikely to be reinfected with the same SARS-CoV-2 once you've developed IgG antibodies. But again, we don't have enough data yet to know, and there may be different forms of the virus. Someone else asks who prescribed those drugs. My experience was very similar to yours, but I was left to manage my own symptoms with only paracetamol. I'm sorry to hear that. And they repeated over and over. It was very scary to feel no one cared or knew what was going on. I guess all the care you had was private. Listen, I have to say this. Even as a doctor with access to doctors, and most of these doctors were friends. I do have a private GP who can prescribe. Even for me, it was very difficult to access healthcare. The NHS are really doing their best, but they're keeping out anyone who's not severely unwell. So it was very difficult to get help. Listen, there are doctors available. Dr. Tim, I've been offering advice. There are private doctors available. the Babylon app, Babylon Health app, which is affordable, very affordable, is offering a virtual GP assistance about the coronavirus. They're also using the data with the NHS. So that's one thing. But yeah, I really feel for you. You know, there were times where it's very frightening because there's no answers. You can't go anywhere. No one wants you in hospital unless you're really unwell. I was unable to get a chest x-ray in hospital because my oxygen saturations were normal. And I was literally brought to tears because I said, look, I've had this for 2.5 weeks. I can barely breathe. Surely I can have a chest x-ray. But, you know, they were very much looking at their own criteria to manage this. But, you know, they're doing what they can in the NHS. So I'm sorry you had that experience. But it is worth engaging with, you know, if you can't afford a private GP or private doctor or don't have any healthcare advice, then, you know, like I said, apps like Babylon can really help. So glad you're on the way. I got the virus too. I did self-medicate with the quinone and azithromycin. I did feel much better, but then a week later developed a low-grade fever. The last 10 days are pretty up and down, but I'm now fully recovered. Great. I pretty much feel that I've recovered, but it took me a long time to feel like myself. The anxiety is crazy, and the malarial medicine made me unable to sleep. So since then, I only sleep 5 hours a day, and I feel very paranoid. I'm really sorry to hear that. Listen, I can only say that the virus can have effects on your nervous system and your anxiety, and also the quinone. It lasts a long time in the system, even when you've stopped it. It sounds like you're a few, 10 days or so past that now. I would be keen for you to reach out to your GP and really talk about the anxiety, and specifically in light of the paranoia that you're experiencing. This may be a side effect of the medication. Not everyone's susceptible to these side effects, but some can be. So I would very much ask you to reach out to your GP or to get some advice there. My vitamin D is 57. Shall I get more? Unsure if that's UK or US values, but you can go up to 100. So I would suggest that you do 2,000 to 5,000 international units at the moment for a period of 1 month. You can have 10,000 units a day if you have symptoms. I always tend to recommend vitamin D is taken alongside vitamin K, phytoquinone, because that can help balance some of the any side effects of excess vitamin D dosing, because it can alter calcium metabolism. So a vitamin D K balance is good. Just going to have a quick drink. Please, can you share whom we do breath work with? Yes. He's a guy called Richie Bostock, Bostok. He's doing Instagram lives. He's also got an app, which I helped him think about, because this whole concept of human flourishing is a big part of longevity. It's called Flourish Guided Breathwork. Is it true that your blood type can make a difference in how severe you get the virus? Type A, get it worse? Don't know. Again, I think that's hearsay at the moment. We need a bit more details. I think that type A personalities potentially might get this more, because we tend to be more driven and then have higher cortisol levels, which can be immunosuppressive. If you have a positive IgG result, are there chances of being denied permission to fly on planes? Again, we really don't know. We have no idea at the moment. Different countries have different policies, so it would depend where you're flying to. And how the government of the country that you're flying to and how their regulations deem the test that you took reliable. We need to have all these tests FDA approved and deemed reliable if we're going to make such big decisions based on them. Can you kindly repeat the 2 types of magnesium? Magnesium glycinate is the one for calming. Also magnesium threonate, something like Neuromag, can really help deep sleep and calming. And the other one is N-acetylcysteine. So that's NAC. And I was taking 1800 milligrams, 2 times 900 milligrams of that. What's the longest a person with COVID can be contagious? I'm not carrying antibodies and my husband is in recovery. Some of the more recent data is showing that people are contagious more early on in the illness, especially, as I've said, they've got things like high viral shedding. So again, this is something that I can't be a bit more helpful on, because we don't really know how we can measure contagion at the moment. I guess the most reliable way would be to do a swab, nasopharyngeal swab, because that would detect active virus in the system, and they are very sensitive, those tests. But in the absence of being able to get one of those, they are available privately, but again, we are, short in supply, and we should be prioritizing people, specifically triaging it. I'm not carrying antibodies and my husband is in the recovery stage. I think it's unlikely that I think if he's in recovery and it's been after 2 weeks after the onset, if it's been a week after he's finished any active symptoms, then I guess it just depends on his recovery phase. There's good information online at the moment, but again, I think it depends person to person. How much is Wellgevity? We are changing up our model to work on a membership model, because I work very closely with people and the attention level is high. We're changing up our model, but the consultations at the Arts Club, which are 90 minutes, are $395, and in that we do a full case review, and there is additional testing involved. Is it worth asking your private GP for prescriptions to the medications you mentioned, and to keep them in case you get sick and can't go out? And is there a shortage of drugs? Also, I'm allergic to paracetamol. Will ibuprofen be okay? Right, a few things there. I do think it's worth asking your private GP for a prescription specifically of cocodamol or codeine phosphate if you can tolerate mild opiates, because the pain can be potentially bad. You've said that you can't take paracetamol, so codeine phosphate or an opiate potentially may be helpful. You discuss that with your GP. Ibuprofen has been deemed not advised. Has been deemed not advisable, but any of the non-steroidal non-steroidal anti-inflammatories, because there were some studies that showed that they can increase your risk of the virus replicating in the body and your immune system response being less effective. So in the first case of symptoms, avoid non-steroidal anti-inflammatories like ibuprofen. Aspirin is probably okay, but non-steroidal anti-inflammatories like ibuprofen or Voltarol I would avoid. So you'd probably have to go for something like codeine for yourself. Azithromycin is worth having, or augmentin, or amoxicillin, because secondary infections of the chest are common, and sinuses, like I said. So I think that's definitely a good idea to reach out to your GP, because I certainly had made sure that a lot of my clients were sorted with some of these medicines. Again, the hydroxychloroquine, jury's out on that, so it's being advised not to prescribe it currently, and it is difficult to get hold of, and it's being reserved for hospital use. Hope that helps. If it's 5 weeks since the onset of symptoms, is it safe to take? It is 5 weeks after the onset. Is it safe to say that you're no longer contagious? Probably yes. I started to take a corticoid prednisone for a health issue today and need to fly next week. I'm aware the immune system can get compromised. How dangerous could this be? I would very much raise that issue with the person that prescribed it for you for the health issue, because we do know that the prednisone and prednisolone, any of those steroids, those oral steroids that you're taking, can have immunosuppressive effects. So it could mean that the virus gets into the body and can replicate more quickly, and specifically as you're flying. But you don't stop any steroids that you've been taking suddenly, you have to taper them off slowly because your body gets used to them. So I would reach out to your healthcare provider that prescribed them and express your concerns. I know it's a risk-benefit analysis, given that you have been prescribed it for a health issue, which you mentioned, I'm not going to say live. Yeah, so do reach out to them with that concern, but it is a real concern. Okay. How long is the virus likely to still be present in your home? Again, like I said out front, if you're shedding a lot of this virus, coughing, sneezing, getting onto surfaces, you know, that it may last, you know, some people say 24, some people say 72 hours. We don't know. It depends on viral load. You know, if you were to cough X amount compared to Y amount, you're going to be shedding more virus. You know, just err on the side of caution, just clean surfaces more, you know, using all of the different sprays and that have been shown to have, you know, be disinfective. So just err on the side of caution. I think it's very unlikely that this really does hang about, you know, on surfaces as long as we think, but please don't take that as advice. There's a lot of data still coming out. We don't know if we can believe some of the data from China. So err on the side of caution. Yeah, we've got one more. Your story is the same as mine. I became sick in Finland and felt back to normal, but then he didn't feel better for till March. My question is, will you shake hands ever again? I personally don't want to, but I don't want to be rude either. That's an interesting question. I don't think I'll be shaking hands. You know, I think there are other ways that we can greet people, and I think handshaking is out for a while. I think we can do other things like, you know, yeah, why risk it? But you know, you've had 3 months, but there's no point. You know, you can pick it. There may be another virus. There may be another, you know, pandemic. We just don't know. So, you know, as nice as it is to have human comfort, you know, especially people you don't know or haven't been around, you just don't know. So err on the side of caution and do the Thai way.
Tamsin, thank you so much for your invaluable insight and time, especially given that you felt so ill yourself. There's so much to take away there. I hope you feel better soon.
I can tell you something with this little bottle, because some people do ask me, I drink it. It's called ketone ester. It's basically a ketone drink. And what that does has been shown to have anti-inflammatory effects in the body, but it was originally used for performance. So when I take it, it kind of can keep your energy level up. It's no carbohydrate, but it is giving you ketones into the blood, beta-hydroxybutyrate, which certainly keeps up my stamina, because you know, even doing an hour like this, an hour and 20 minutes is quite tiring. But I'm really glad we made it. I hope it's been helpful.
Can you even take that when one's not ill, or just when?
Yes, sadly I'm a little bit addicted to it because it has such profound effects on my energy, but it's hugely expensive, so please don't tell me if you become addicted to it like a few of my clients have. But it's only healthy, but one bottle like that is about £37 in the UK.
Yep. Thank you again, Tamsin, and thank you to our audience. Stay healthy, everyone, and good night.
Good night.